Healthcare will remain broken if all the different interest groups within the organization keep fighting for their one cause instead of everyone uniting together and working towards the same cause. I first started my healthcare leadership journey in 2012. And for a long time, I would focus only on making patient outcomes better. That's what I wanted. I wanted patients to get better. I wanted them to get better care. I didn't care about anything else. And I was very loud at all the meetings. And eventually I started noticing, wow, we're all being loud and we're not listening to each other. And luckily, within the last 8 years, I've started to shift into really just listening to what are the people from the operations side saying? What are the people from patient experience saying? What are the financial people saying? And what are the employee health side saying? What is everyone saying? And the more I listen, the more I see really it's very similar. We're just all speaking different languages. And I have experienced more success with supporting patients to do better when I start to make the connections between how will that benefit these other interest groups. So for example, if I have an initiative that I really believe will improve patient care and I come forward to our leadership who is there to make decisions, taking into account all the different interest groups, all the ones I named earlier, the financial people, operations, patients, and employee benefits. If I come to that group ready to share my initiative for improving patient outcomes, and I also start to share how this is financially savvy, how much money it will save. And then I start talking about how this patient outcome actually is connected to retaining our staff. That when it's fully implemented, staff report feeling better, that tend to stay longer in organizations who might be doing something similar. So I'm taking care of like the staff retention people. And then I start saying how this patient outcome I care about the outcomes, but I could also start talking not but and not only is the outcome good, but patients actually will likely report a better experience. And then if I want to address how this will improve the safety of the organization, I'm more likely to move forward if I am speaking the different languages that are present in the room and showing how this one thing benefits everyone. I've really changed how I operate. I used to be really loud and emotional about why something had to happen because I just wanted the patients to be and do better and feel better. And now I'm understanding that the reason my success was limited before in moving forward these initiatives is because I was really speaking to myself. I was saying the things I wanted to hear, the things that mattered to me, and I wasn't listening to the needs of the organization, the whole. I started realizing that ironically, so I am in the work of prevention. I am in the work of wanting to treat the whole person, not the symptom. And yet, I was doing that in the way I was presenting. I was focusing on one small thing, patient outcomes. And I was yelling, yelling, yelling. Well, I wasn't really yelling, but I was loud and insistent. And that's, if you're to compare it to whole person care, that's just a symptom. It's not taking care of the whole. And I've learned more and more that if I can be a part of improving the whole organization, not just the little thing that interests me, in the end, we all benefit. And we actually, I will experience what I'm seeking. When an organization is healthy and whole, it is very natural for one of the outcomes to be better patient outcomes. I'm really excited about this, and I've been putting more and more energy into this idea. And I just would love, if you're watching this and you have thoughts on this, I would love to have a conversation with you. I would love to hear some of your ideas of how can we all start to speak the same language? How can we work towards benefiting the whole organization and not just little parts? How can we all win? And how can we ultimately heal healthcare? Thank you so much, and I hope you have a great day.